Good afternoon. Welcome to the a daily briefing at the St. Clair County EMA, where it's Friday, and it's been a long week, Sam. Every day has been long.
It has.
And we're getting ready to go into the weekend, so why don't you give them the daily news?
So as we've done, in the past couple of days, we've said that we've been happy with our numbers and the way things are trending, and I would say that that is true today as well. So for St. Clair County residents that have been tested, we are currently at 4,362 with 825 positive test results, which is an increase of 20 from yesterday. And that includes both males and females from their teens up to their 80s. And for any of those that have been following along with our briefing, either just in the past couple of days or for several weeks while we've been doing this, you will see that we are starting to have kids that are younger and younger. We're seeing in their teens and under 10 more and more than we had in the past. So for those that thought this virus was only for the elderly or only for those that were immunocompromised, we're starting to see that is indeed not true. We're starting to have more and more younger people that are positive. So as of today, we are at 3,499 negative test results with 38 still pending. And we do have some sad news to announce today. We are reporting one additional death, which brings our total to 67. And that was a man in his 90s who did have underlying health conditions. And as always, our thoughts and prayers go out to that family. For those individuals that have completed the required 14-day quarantine period, we are at 419. For state totals, we have tested 538,602, and we are at 90,369 positive test results, which is an increase of 2,432 from yesterday. And for the state, we are at 4,058 deaths, which is an increase of 130 since yesterday. For hospitalization numbers, and those are for hospitals that are in St. Clair County, we have 49 patients that are currently admitted due to COVID-related reasons, and 6 of those patients are on ventilators. For congregate living facilities and outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has increased 1, so they are at 7 cases and no deaths as of today. Colonnade Senior Living in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 103 cases and 17 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 2 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 10 cases and 3 deaths. Swansea Rehab and Care in Swansea has 4 cases and no deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. So, Sam, let's talk a little bit. In your report today, it looks like 159 people, if my math is correct, were tested from yesterday to today, or at least that's the number reflected. Day before, it was 187. That number seems low to me.
It is, and we are encouraging anyone out there, you don't have to have symptoms to go get tested. We are encouraging everyone to go get tested at this point, and we do have a testing location at the Walgreens in Cahokia that you do not need to have any symptoms to go get tested. And the turnaround time for that result is pretty quick. We're talking anywhere between 30 minutes and 2 hours, so you should find out the day of that you are tested what your result is.
And we've really been told that although I think the Memorial testing site still is maybe holding fast to you got to have symptoms or you have to know someone who is COVID positive or be a first responder. Every other testing site seems to say, come here, it's free.
Yes.
You don't need any symptoms. You don't need to have a reason. Come on in and get tested. And that's what the governor's office is urging everyone to do.
Yes.
Get tested. And the reason for that, Sam, is because
we could have no symptoms and still test positive for the virus. So, we want those numbers, we want that data, because that's the only way we're going to be able to look at the big picture with the finest lens, if that makes sense.
And see the spread cease, or at least get in where it's controlled. That's the important part. And so our testing numbers appear to be, when people go out and get tested, it's a pretty low rate of people that have COVID, but people who maybe be out there that would not have been tested before have been found to be positive.
Exactly. And if you think about, if I go out and I'm having no symptoms and I go to the grocery store, even though I do everything right, I'm wearing a mask, I'm using hand sanitizer, I can still, unintentionally spread COVID. And by not being tested, even though I feel fine, it's a possibility of putting others at risk. So that's why we're encouraging everyone. Southern Illinois Healthcare Foundation has several test sites now. We've got the Jackie Joyner Kersey site in East St. Louis. We also have, as we said, the Memorial Drive-Thru and the Walgreens in Cahokia. So there's a lot of options for people as far as, where they live, testing sites near them, or if they prefer a certain facility.
And even beyond the grocery store example, at home, you don't wear a mask, you don't wear gloves,
Exactly.
you're in with your family unit, and so it's kind of important to protect them, especially if you have someone who's elderly or immune compromised, or really just anyone. It's time to get these numbers up. The governor's asking for it, and they're free, and so there's no reason why we can't have a lot more people getting out there, getting tested, and helping us to get through this, so we can make the point that the area has COVID, hopefully under control, and we won't know that until we get more numbers out.
And there's nothing worse than seeing a little one, that's a small child or an infant, be sick. And just as you had given the example of someone elderly or compromised in your house, the last thing you want to do as a parent or a relative to a young child or an infant is pass along what you might have to them, especially if you're asymptomatic. So that's why we're encouraging everyone that has not been tested so far to please call any one of the test facilities that we have in St. Clair County and go out and get tested.
Chairman, I think it's worth mentioning that the physicians that we've had on the briefings have all said the same thing: testing, testing, testing. The governor is basically following what IDPH, Sam, my understanding is, the task force of the doctors and the scientists and them is the ones that are providing that information to him. He's just kind of the messenger. Just same as these physicians have this came on here, there hasn't been one of them come on here that has said, no, you don't need to go get tested. They've all said, go get tested. So I think that's worth letting everybody know that the medical people are what's driving the testing part, because they want to know.
And part of what might be in our heads at the beginning, there were no tests. I mean, we remember when there were 10 tests total that had been given in the county at the very beginning of this. So now it's time to change the mindset. You're no longer saving tests for people who are sick. It's now go out there, get tested, even if you feel okay, so that we find that number. Tonight, I think on Channel 4, I don't know what time, but there's going to be a show about a hospital and how they deal with COVID patients, and I think it would be educational, and I'm going to watch it just to see what the nurses and the doctors go through when people are in the hospital. It looks, I think it'll speak a lot as to why we need to continue to take this seriously and get tested.
Absolutely.
So thanks, Sam.
Absolutely.
So we'll move into the zip code report. Today, 62201 remains at 13. 62203 remains at 26. 62204 remains at 33. 62205 remains at 37. 62206 remains at 74. And 62207 remains at 52. 62208 has an increase of 1 to 46. 62220 remains static at 87. 62221 now has 73. That's an increase of 2. 62223 remains at 42. 62226 is now 103, an increase of 3. 62232 has 8. 62239 has 11. 62254 remains at 24. 62257 remains at 8. 62258 remains at 14. 62269 remains at 61. And 62285 remains at 7. So we've got a good number that didn't have an increase today. Remember, if you didn't hear your zip code, doesn't mean that you don't have COVID positive diagnoses in your zip code. What it means is that hasn't risen to the level above 5 yet. So Herb?
Yeah, and just real briefly, Chairman, these citizens that follow our briefings every day, we answer their questions, and they always have some good ones. And I think it's just important that we see good comments and bad comments. And the bad comments are, oh, this is nothing. But I just want them to stop and think, and I know you and I talk about this all the time. If you look at the death rate that we've had here in St. Clair County, and Sam touched on this earlier, yeah, we've had a lot of them in the long-term healthcare facilities, and you see these comments, well, these people, 80, 90 years old, they're going to die anyway. My question to those people who have that negative attitude is, what if that's one of your loved ones? I mean, don't you agree, Sam? I mean, I know it's hard when you have to sit there and report them. Again, we're not trying, I guess we are trying to paint the bad picture. I don't want to be the one to have to pick and choose which one of my family members is going to get the virus.
And I think too, the old saying is, until you've walked a mile in my shoes. For those of us who have not experienced a loved one close to us and seen how hard this virus can be on someone, it's until you experience it, I think sometimes it's hard to grasp how intense it can be and how hard it can be on someone. So as you said, unless you've been in that situation, it's hard to grasp the concept of a whole big picture.
And just because someone lives in a long-term care facility, that doesn't mean that they're there and that they're ready to die.
Mm-hmm.
That it perhaps just means that someone can't take care of them with the needs that they have at home, and that's why those facilities exist. It isn't fair that they are discounted because they live in a long-term care facility. And when we looked at the numbers, it appeared it was somewhere around 60% of the deaths were attributable in St. Clair County to long-term care facilities. 40% is still a large number out there. And then as far as infections go, it was really only about a third of the people who were positive are in those facilities. The rest are out in the general public.
Well, and I think that's what I wanted to mention here is Sam, just don't go to bed at night and dream these numbers up. These are factual numbers that are presented to the health department by the hospitals and the healthcare providers, and we have the chore of bringing them to you. And we just want you to understand that, yesterday, 20 new cases in St. Clair County, 1 new death. That's one person, and everybody says, oh, it's one. We're a population of 270,000. One is too many. We're up to, 67 deaths in the county now? And just stop and think this. Just over the weekend, just stop and think, do you want to sit there and ask yourself, which one of my family members am I willing to sacrifice? Because I'm not going to sacrifice. I mean, we're going to do what we can to stop the spread of this virus. And I said it yesterday. We keep talking about the governor. I don't care if you like the governor, if you don't like the governor. I happen to, but I'm telling you, he is doing, if he hadn't done what he's done now, that number of 67 deaths in this county and across the state of Illinois, the scientists, not the governor, the scientists, the medical experts have said it would be worse. And I'm not willing to roll the dice. So please just listen to what we're trying to tell you. For those of you who follow us every day, we appreciate it. We hope you share this because that's the only way we're going to stop the spread of it.
And these numbers don't stop here.
No.
So then these numbers go up to Springfield and Chicago, and the doctors and the advisors look at our numbers. They merge them with the Southern Illinois district that we've talked about, the hospital districts 4 and 5.
Yes.
And that is how we're going to be able to reopen when our numbers and everybody others, everyone else in our district's numbers meet the levels that those doctors are recommending to the governor. And so when we made a plea to the governor, we wrote a letter and said, let's look at the metrics and see if we meet those yet. And they are looking at that. They've responded. They're in communication. So hopefully, as the numbers get better and look better, we'll be able to open up more.
And I think that's a good point. We just didn't send those letters from all the mayors You know, there's some questions that come up there nightly. You know, where is the mayor here? Where's the mayor there? Every one of those mayors that we meet with every week are supportive. Yeah, do they want their communities open back up? They'd be a fool not to.
But every one of them says
safe.
they only want it open if it's safe.
Oh yeah.
And that's that's where the governor's relying on the microscope
Sure.
as far as deciding.
And it's just not here. Madison County, and we'll talk about that real quick because they chose another path, but some of their major cities over there said, no, we're going to support what the executive order says. And everybody refers to it as the governor's order. It is, he's the governor, but the science has driven that. And that's who I think our health department, I mean, Sam, you know, you've been 60 some days now, and I know you would like to be doing something else instead of coming over here with us all the time. But this is our job, your job especially, and we got a long way to go. This is, like we've always said, it's not like flipping a light switch. If it would have, I'd have been the first one switching it. So please, as we go into the weekend, just stop and think about that. Think about these numbers. They're not going to stop overnight. We're where we want to be. We're waiting for the end to come, and we're all in this together. So please tell your neighbors, tell your families, social distancing. If we get a word back that we can move farther, faster, we will. We'll let you know that. But right now, let's look at the 29th, I think was the date. And if that's what it's going to be, that's what it's going to be. So please, stop and think of what I just told you today, what the chairman said, what Sam says, and pray for Sam because she's got to put up with us all the time. So we'll be back shortly. EMA side, we had a conference call with the hospitals and the EMS again today. Went good. A conference call with the IEMA deputy director. Our conference call with them was good. Received some more of the PPEs, and we've got more coming in on Monday. We're trying to keep our first responders and them in supply of all of that. We'll give you some more on that, what comes in Monday. But we'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities. And we'll see you back here Saturday afternoon at 3:30 for the next daily briefing. Thank you.